Good evening, I'm Dr. Kenneth Levine and welcome to Health Talk. Health Talk is a show about all your medical issues from the top of your head to the bottom of your feet. I'm a dentist. This is not a show about dentists. I'm a periodontist. I deal with gum and bone and dental implant issues, cosmetic procedures in the mouth. We treat patients in my office in Tamarack, Fort Lauderdale of all ages from 3 days old up to almost 100. We'll talk a little bit about that later, but I'm very anxious to introduce one of my guests this evening, Dr. Richard Greene. Dr. Greene, you're a good friend of mine, but you are a dermatologist to the stars. Welcome to our show.
Thank you so much. Glad to be here.
You know, one of the interesting things, one of the important things about being a dermatologist in Florida. Well, first of all, how did you get to Florida?
It's a very interesting question. I was a Boston-trained dermatologist, and I had a chance to go back to the department at University Hospital, which is part of BU, and be the fourth or fifth man in a department. And it was the year that they had the Academy of Dermatology down in Florida, and I came down here. And on my way back, I heard it was snowing and so forth, and I looked and I said, why wouldn't I come to Florida and practice? It's a wonderful place for a dermatologist because of the sun, the age of the people, etc. Right. And it just seemed like a great opportunity to get away from being the fourth or fifth man in a group and be my own head.
You know, it's interesting. I'm originally from New York and I trained in Philadelphia. I had opportunities to return to Philadelphia, go to Baltimore where I went to dental school, return to New York where I grew up, where my dad was a dentist, and my wife said, I want to go to Florida. So I just had to listen to one person. She had gone to the University of Miami. And here we are, and 40 years later, it was a great decision.
That's right. We came in '70, and the problem with going back to Boston was it was really an academic position, and I love people, and I wanted to work with people. I like to teach, and I like to see the patients, and so this was a better opportunity. I no sooner opened up, and I was offered chief of department at a few different major medical centers, but I decided to be in the clinical field.
Now, when you started, were there other doctors in your practice? Did you join a practice, or did you begin your own
I actually
practice?
started with a very dear friend, Dr. Joel Wilentz, and happy to say we're still practicing together after over 40 years and still doing very well. We've grown from a 2-man group to a 52-man group, and we occupy everything from Tallahassee to Key West, so we're very proud of our group. We've really put together nice array of people, very, very special people.
Now, from being all the way from Tallahassee to Key West, do all 50 some odd of you get together at one time at any time?
We do. Once a year we always have it, the holiday season and so forth. But most of our people are South Florida, or Broward-Dade and Palm Beach County. So those are the people that we see on a more routine basis. But my office interacts with those people from afar, helps them with their technical problems and all the other things that go on in our field.
Now, in dermatology, there are subspecialties. Is that right?
Correct. Most people really do a wide variation. Most people do everything from skin cancer to rashes, etc. But there are subspecialties like Mohs, microscopic surgery, which is for the bad skin cancers. We have 7 or 10 Mohs surgeons within our group, scattered all over, and they get the harder cases that have recurred or have come back from previous surgery or in different locations, and we're glad to have them. You have to have them today.
Now, in your group, do you also have the laboratory that does the processing of the
Yes, we became so big that we didn't want to rely on a lot of outside opinions. So we have 3 wonderful full-time pathologists who just do skin. And if people come in and we just send to their lab, you're going to get somebody who may be a general pathologist looking at skin, and they're okay with tumors. They're pretty good with cancer, yes or no, but not so much with inflammatory dermatologic diseases. So we find it a great advantage to have full-time dermatopathologists.
So these are dermatologists who also became pathologists?
Well, 2 of our people are dermatologists who became pathologists. One was a full-time professor at Johns Hopkins, who was academic, and we asked him to move down here, and we actually arranged for his training at the university.
Okay, we're going to come back in just a couple minutes because we have a break now. I'm Dr. Kenneth Levine. We're streaming live on the web, by the way, at WEYW19.com, and I'll see you in just a moment. Thank you.
When you're smiling First impressions are priceless.
I'm Dr. Kenneth Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.